Welcome to the Hong Kong U Leadership Forum. Today we will be talking about leadership in oral health. I'm Thomas Flemmig, the Dean of the Faculty of Dentistry, and I will be the moderator for today's session. Now, oral health is part of health in general. Health by the World Health Organization has been defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Health, therefore, cannot be without a healthy mouth. Oral health includes diseases of the teeth, the supporting tooth structures. It provides the ability to chew and eat, and smile and laugh. We are glad to have a astute group of speakers today. And our guest I would like to introduce is Dr. Raymond Lee, the chairman of the Hong Kong Dental Council. Mr. Godfrey, welcome Raymond. Mr. Godfrey Ngai, co-founder and CEO of the Modern Dental Group Limited, as well as Honorary University Fellow of Hong Kong U. Welcome, Godfrey. Dr. Century Tsang, who is the president of the Hong Kong Dental Association. Welcome, Century. And last but not least, Dr. Charles Yeung, the president of the Hong Kong U Dental Alumni Association. Welcome all of you.
Thank you.
Now, when it comes to oral health, we have a number of players that are involved. We have the people, the patients. They play an important role in prevention, self-care. We have the providers, and we will be talking about providers quite a bit. On the one hand, the education of dentists and dental specialists for Hong Kong. The Faculty of Dentistry has educated about 2 in 3 dentists, and 2 in 3 dental specialists in Hong Kong. The number of dentists we have in Hong Kong is fairly low compared to other developed nations. We'll talk a little bit about that. Those providers are mostly in private practice. Some are working with the government, and some, like myself, in academia. And then we have payers. Oral health is fairly expensive. About 1 out of every $20 spent on healthcare in general are spent on oral health care. And for Hong Kong, most of that is out of pocket. The public funding of oral health care is rather limited for children between 6 and 12, where it has a very demonstrable effect, and more recently also for elderly when they have lost their teeth. And then there is industry, which plays an important role in many ways for oral health care. Now, when it comes to leadership, there have been many definitions of leadership. One is that a leader is one who manifests vision, integrity, and courage in a consistent pattern of behavior that inspires trust, motivation, and responsibility on the part of followers, who in turn become leaders themselves. Now, one aspect of true leadership is that it must be for the benefit of the followers and not the enrichment of the leaders themselves. Now, let us start with the discussion. How do we develop leaders? And the university educates dental professions, and we try to aspire to bring those young dentists very quickly in contact with leaders in the community. On the one hand, they're very self-organized with the dental society and develop leadership among themselves. And then there is a mentorship program which is well established, which brings together the students with established colleagues in town. And may I ask on Charles to tell us a little bit about that, the benefits and the impact he sees in that?
Sure. Well, talking about the mentorship program, it is one of the highlight program of the Dental Alumni Association with the faculty. So it aims to develop a healthy personal relationship in a professional context between the mentors and mentees. Basically, is each of the dentists will pair up with one or two PDS, that is the undergrad dental students, and at a time where they start the placement, which is PDS free. Okay, so our mentors are all very distinguished members and alumni in the field. So they have a variety of backgrounds. So say last year we have a former chair professors who is now in the private practice, and we also have distinguished alumni that has set up quite a lot of dental clinics and running them. And we have, government officers, dental officers who is having a management role. So as you can imagine, we have a very big variety of mentors, and they do all have their own stories. They have their own life experience, and also they have specialized dental skills as well. So with this mentorship program, we always, encourage them to have more interactions, and say, normally what we would do would be like clinic visit, shadowing, and some of the mentors would like to bring the mentees to the conference together, okay, and they even do the purchasing there. So it's really a real life learning. And also, some of them who are very interested and enthusiastic in servicing, they will do the service together, to help the needy. So with different mentors, you learn different things, but most importantly is you have a chance to have a taste of the future professional life and how the adult world is. So I think they are all very good models, good role models, and we often find that the mentors and mentees become very good friends after the program, and they build lifelong relationships. So, for example, one of the mentors that I know, he allows his mentee to work as the dental surgery assistant in every summer. So that could be like 3 or 4 summers time, and they are. Actually, if you know, it's a very good way of learning because you're just next to the dentist. You see how he works on the patients. That's for the clinical skills, but how he deals with the patient is also very important in terms of patient management. And of course, outside working time, how they manage the clinic, the logistics, and everything is something you definitely cannot learn or would be weaker learning in the university. So it's a good supplement to the classic learning. So after they have been working for a few summers, eventually this dental student graduates and become the associate of that mentor. Now, I think it is really inspiring and encouraging. I mean, you have a role model and you work towards him and you work with him. So I think this sort of learning is really precious. And I'm very encouraged to continue the program. Yeah.
Great. Thanks, Bob. It's wonderful to see how these partnerships then evolve among different generations of providers. I also understand that the Hong Kong Dental Association plays an important role and may call on Century to talk a bit about the volunteer work that the association organizes and also involves dental students in that.
Thank you very much, Dean. And hello, everyone, and Century. And talking about the overseas volunteer work that's organized by the Hong Kong Dental Association, it was started actually 2 years ago, and it is the first time for us to go to Cambodia to deliver voluntary services to the primary school students there. And we do some very primary and basic dental works for them. And in last year is the second year that we expand a bit this program. And we have got 60 participants joining us to Cambodia, including the dentists, the dental students. Some of them are the fresh graduates. And also we have dental surgery assistants, hygienists, and also secondary school students. Actually, those secondary school students, they have applied and showed the views they want to get into the dental school. So they join our trip, assisting the dentists and learn how we work and how we treat patients. And we have several focus in our Cambodia project called the Healthy Smile Cambodia. One of them, we focus on continuity, because one of the volunteer work, it means nothing. So we hope to go to Cambodia every year. This year is a bit exceptional because we have the COVID now. And actually we plan to do it in a continuous way. And secondly, we are very focusing on the infection control, because most of the volunteer work may be a little bit compromised in the infection control. But we bring our own Class B autoclaves, which is a high standard autoclaves, and we use pouches for sterilization of the instruments. So we hope, certainly, maybe in a certain extent in this difficult environment, it's very hard to do a very good infection control. But we have tried our best to do that in order to keep the standard. And thirdly, we want to stress upon that prevention is very important. So we not only to treat the patient, but we also design some of the funny cartoons leaflets in Cambodian languages. So the people there can know how to brush, how to care their teeth. So in the long run, they can learn how to do oral hygiene instruction well. So which is better than we just go there and then treat their teeth once a year.
Right. It's good to see that there is sustainability and allowing the people in Cambodia to make sure they provide sufficient preventive measures themselves, and that the students actually enjoy being part of that before they enter the faculty. The other part when it comes to leadership is how do we assure the quality and enhance the quality of oral health care, and continuing professional or continuing dental education plays a major role there. And essentially, there is a lot that the Dental Association does on the side of voluntary continuing education. May you comment on that a little bit?
Yeah, sure. One of the work of Hong Kong Dental Association is to organize the continuing education courses for our members. And we have got around 2,150 members. Part of them is from government, and also we have got most of the members from the private practice. And for the continuing education courses, we deliver it regularly in some of the monthly meetings, very regular. We have organized quality continuing education courses. And also in terms of some young group night evening lectures. And also once a year, we have got Hong Kong Ideas, Hong Kong International Symposium and Exhibition, and we organize 3-day courses to give members a great choice for different topics, not only on clinical part, but we also mentioned about like topics in ethics and infection control in order to maintain a high standard of the practice for our members in their daily practice. And also we also advocate some workshops so they can join the workshops and learn the clinical skills.
Very good, very good. The Hong Kong Ideas, I understand, is one of the largest events in the region in East Asia, Southeast Asia in that respect. So it draws people from all over the place. At the same token, industry plays a role in the quality assurance and quality enhancement. And Godfrey, I know your company has recently entered that space and had a number of very impressive events going on. Is there a potential conflict of interest when the industry that works closely with the practitioner gets involved also in the education?
Of course, if we are running the meetings or seminars or workshop or symposium, whatever it is, in a more academic manner, rather than using it as a marketing or advertising, then it would be good. For example, for modern, every 2 years we host the World Dental Forum, in which there are several hundred dentists from abroad coming to this meeting, and we found it very successful. I guess if we keep a neutral stance to show all the dentists the new technology, new technique, and sharing our experiences, that would be nice.
Very good, very good. Raymond, should this continuing professional education be mandatory? Right now in Hong Kong, it is voluntary, with the exception of specialists. And in several other places around the world, there is a mandatory requirement for dentists in order to maintain or renew their license to demonstrate a certain amount and quality of continuing education. As chairman of the Dental Council, what's the regulatory point of view on that?
Yeah, Professor, thank you for having me. Yes, actually, according to the 2017 strategic report from the government on the healthcare CPD manpower development and the continual development, they do have a recommendation to suggest the health profession, including the dentistry, to run the CPD program in a mandatory way, and that is the direction that we set for the council to make it into a reality. So recently, actually, we have kind of improved or enhanced our CPD program and worked toward that end. In order to make it mandatory, we have to increase the supply side. First, that means we have to make all the courses available to all the dentists in Hong Kong. And at the same time, we have to quality assure them in a way that we set up a system of accrediting program provider. All right. So we have been working very hard on that side, and the development is quite encouraging. And the next step is to whether we to decide how to make it mandatory, either by amending the ordinance or incorporate relating to the code of practice. That is something we are still under consideration. But I think we are in good place on the how to implement mandatory CPD program in Hong Kong.
Very, very, very nice. Just in general, if members want to chip in and chime in, please just go ahead and participate in this. So I'm just trying to moderate it. But let me one follow-up question to Raymond. I think in my mind, there's no question that it's good for a profession to have a quality assurance measure in place, just like a mandatory continuing education. How can one assess the effect of the quality assurance or enhancement measure? Is there a way how the profession or the regulator can determine that it actually improves the outcome and the care?
Well, that is quite an academic question. We only have the chance to assess when we have done it. Sure. So we have to kickstart it first. Okay, there's beside the effectiveness of a program, which is very important, there's other consideration as well. the effectiveness, we try very hard to incorporate something we consider to be essential and core to the practice of dentistry. So that go back to the fundamental question, why CPD should be mandatory. But that is a basic question to answer before we decide to make it have a go, right? So so we in the council, our stand is in the practice of dentistry, some core competency are quite essential for safety and for the public interest. So in that respect, and we incorporate a condition that some of the, not some, all of the participants, if you want to comply with the CPD program, they have to attend those core competency that include, quality assurance, record consent, all relating to the safety of the patient. And also we also encourage the dentists, all dentists, to develop further themselves, especially in this era of technological advancement. Right? So that we really can't explain to the public if a dentist operate on any patient without further development of their skill and knowledge and consider they are safe. That is quite a difficult question to answer. So that is the spirit behind the mandatory program. And yes, we have to keep that in mind. We have to assess the effectiveness. We have to do it, properly, so that we can kind of fine-tune our program and ensure the public or ensure the profession there is something have to be done.
Right. I mean, the role of the regulators, of course, always is to put down regulations, and all with a very positive intentions in the most cases, of course. But then it also, I think, is in the interest of the public to see whether or not the regulations do what they intend to do and find that. In the same token, in order to enhance the quality, it also goes along with enhancing access to care. And that relates to manpower. Now, the government has been very active in increasing the number of dentists that our faculty is educating. We have increased our capacity by 50% over the last couple of years. We increased the capacity of our specialty education, the postgraduate programs, by more than 100% over the last couple of years, and continue to do so. So that relates then to a proper planning, and the government has a manpower planning. The last thing I've heard was that the LegCo has rejected the methodology that was applied for the upcoming one. Can you give us an update on do we need more dentists? Are we going to reach a level of saturation soon? And what are the parameters that really drive the manpower need?
Oh, well, according to the same report in 2017, the strategic report, there is a projection of manpower shortage in dentists. And if I can remember correctly, in 2025, we are sort of in the range of 100 to 150 dentists. So after the report, I think the government have been very proactive in tackling the shortage by increasing the number of undergraduate entry in the faculty. I think it's from 55. You got the number.
53 to 80, yes. You're pretty close, yeah.
Okay. And well, for the dental council as a regulator, what we can do is to look into the licensing exam, okay, which is one of the possible way to kind of increase the manpower in Hong Kong, but without, of course, sacrificing any standard of a safe dentist. All right. So the council have been enhancing the examination over the years by several measures, for example, retention of the partial result and double up the frequency of the licensing exam. If I can give you the data, before 2014, we have around 6 dentists can be registered in Hong Kong for licensing exam. But up to last year, the average is up to 20 something. It's 23, 25. So there is about 3 to 4 fold increase in the manpower. And one thing I have to reiterate is Dental Council is not the one to produce dentists. Okay, we are the gatekeeper to ensure
you prevent them
the
from
licensing exam is extended, that all the licensees are safe to practice. That is one thing, right? But I think the faculty showed even more heavy responsibility to do the same, right? So how do you feel? How do you feel about the increase of the undergraduate entry? What are the challenges?
Oh, so from my perspective, I like to use various approaches when it comes to projections, and as projections are usually a rough estimate and often not very correct. I try to triangulate and use, on the one hand, the internal projection, and then also look at comparables around the world. So what is the density of dentists in other developed nations or cities? And clearly, Hong Kong is on the lower end of the spectrum when you look at the data from the OECD. And there's no doubt in my mind that actually the number of dentists, even with the increase that I just alluded to, is still in need of further manpower in that respect, on the undergraduates or the BDS side as well as then the specialty side. But it's of course a more complex problem, because it not only is the supply, but it's also the demand. And the demand depends, among other things, also on funding. If it's publicly funded versus out-of-pocket funding, how's the economy doing? And we just talked about, before we started, due to the recent pandemic, many of our colleagues are not as busy as they used to be, because people just are more careful, on the one hand, because of the potential risk of cross-contamination, as well as financially, I guess. So that's that. Century, you represent most of the dentists in Hong Kong with the Hong Kong Dental Association. They're all members. I'm a member as well too. So do our colleagues really in the profession want more dentists?
Do our colleagues want more dentists? Sorry, I beg your pardon? Yeah.
Yes, that was the question.
Yeah, a very good question, but I didn't have any survey results on this question to provide you the correct answers.
Well, what's your hunch? What's your hunch from dinners and luncheons?
Yeah, actually, some colleagues did suggest that it is not easy for them to hire an associate in recent years, because they are the boss and they want to hire some associates for their practices. The salary is quite high for dentists now. Also, it is not very easy for them to hire one associate and keep them working in the clinic for more than 2 years. So it is, maybe this can give you some projections on how the manpower condition.
Good. I mean, the high salary is good for us as a faculty, because we can say that our graduates are doing very well when they go out into practice. So that is always two sides to a story when it comes to that. Charles, what's the role of a specialist when it comes to quality enhancement of oral health care? Are only those patients who are being referred to a specialist benefiting from the advanced training and skill in a particular discipline? or do specialists also help to lift the quality across the board?
Well, thank you for the questions. Actually, I think specialists play a very vital role in, raising the bar of the quality of the treatment. So, as you said, as we all know as well, that previously the master program is self-funded. So, as a specialist, you have to fund yourself for the whole pathway. So, the 6-year training was at own cost. So you can imagine this group of people, they are very enthusiastic. They want to have a high level of knowledge for better patient care and standard and techniques. So even after they become a specialist, they are always learning. They attend international conferences, and they exchange ideas and knowledge and skills. And in that way, we stay connected with the world, and sometimes we make good friends with those, outstanding speakers and leaders in oral health around the world. And after that, we do invite them to Hong Kong, to educate other specialists and the general practitioners. So as I remember 3 years ago, we do have invited an American orthodontist to come to exactly the Hong Kong Ideas, which was organized by the HKDA, to talk about, the mini implant assisted maxillary expansion, which was relatively new ideas, avoiding the surgery, osteotomy of the maxilla, while we can do expansions in the adults. So that is a very, very good advancement for the patient who has a posterior crossbite and narrow maxilla, because they avoid them from doing, general anesthesia and then, open flap surgery. And in that sense, the faculty also play a good part, and the department has been trying out the techniques. And actually this year, we're trying to invite the speaker to come back again. And, although it's not successful because of the COVID-19. But in that sense, we bring in new ideas, we bring in new technologies, we train people to do that. And as a specialist, we also then, do some cases and, show our colleagues, the general practitioners, although sometimes some of the new techniques, they may not be able to, provide them because of the level of proficiency required, but at least they do know that there is an alternative, so different conditions for patients. So at appropriate times where they cannot handle the case, we do a proper referral, and this is part of it. And also, not only we are raising the bar just in Hong Kong, we also do lectures around the world. And one of the very closely tied area, of course, is China, and our colleagues have been lecturing in China for long. And some of us are even examiners for international exams held in China. And lately, I know that there are some private dental institutes set up in Hong Kong by some of the specialists and dentists in collaboration with the Royal College in England, with the aim to educate dentists to do advanced work like implant and orthodontics in China and around and also Asia. So in that sense, the specialists in Hong Kong actually is leading the whole area and trying to improve the quality of care in the whole region.
Very, very good, very good. And one thing the faculty has initiated a couple of years ago now, the Institute for Advanced Dentistry, which will deliver the education on the one hand for dental specialists, but also expands beyond this to continuing education, the ability to do skill training and also didactical training. And I think this is a continuum of education starting, as Century pointed out, not even in dental school, but even before dental school, where the secondary school children who are interested to go into healthcare learn about oral healthcare. And then it goes all the way through dental school, postgraduate education, and continuing education. It's really a lifelong learning aspect. And in particular, with the acceleration of technology that we see in oral healthcare, it becomes more and more relevant nowadays. Let's move on to another topic which one often doesn't like to talk about, which is money. Any healthcare system requires funding, and it needs to come from somewhere. Otherwise, dental practitioners like you or industry like Godfrey's can't survive without having cash flow, without having someone to pay for that. And now Hong Kong is quite specific. It has a universal healthcare coverage in medicine, but it has a rather fragmented funding mechanism in dentistry. In dentistry, the publicly funded dental care is more or less limited to children between the age of 6 and 12. And at that age, Hong Kong's children have very healthy teeth, healthy mouths. But then when the publicly funded care drops off at 12, the disease prevalences basically go up in that respect. There's some initiatives. One I want to point out is the early childhood caries funding that the Jockey Club provided to a team at the faculty led by Professor Chu, who is developing an infrastructure to provide preventive care to children in kindergarten, really across the territory. There is also one that is administered by the Hong Kong Dental Association for edentulous patients, and maybe Century, you want to comment on that a little bit.
Yeah, and it is a community care fund program, and actually this program is a PPP scheme, which is known as the private and public partnership working together. That means the government and also the private sectors. For the elderly people, they can choose their own dentists from the general practice, and they can have the denture for replacement of their missing teeth and a number of basic dental procedures together with the denture to deliver to them through this program. And actually this program was initially run in 2012, and its expansion starts in 2015 and now running till this moment. We have around 1,000 points of service that can provide service to the elderly. And until now, we have got around 80,000 elderly patients already received denture from this program. And actually, it is still under enhancement, and we want to make more people they are eligible, because initially we start from the eligible age of 80. If they are 80 or above, they can be eligible for the program. But now we're just lowering the ages to now it's 65. Yeah. So in the future, we may want to enhance the program by a certain sense that we can include more people in to be benefited by this program, not only from the age, but also the spectrum that we can cover.
I think that provides a very valuable service. When I came to Hong Kong several years ago, one gentleman whom I met who learned that I was in the dental faculty said, like, "Oh, your faculty is the most important faculty of all of Hong Kong U." And I said, "How come you say that?" I said, "Dentistry is the most important field." I said, why do you say that? He said, like, without proper teeth, you can't enjoy food. And so to him, that was the important part. Without the pleasures of eating, it was not worth living. So it goes back to the quality of life that we provide. And if elderly have no teeth and can't really enjoy the lovely foods Hong Kong has to offer, then there's a different quality of life there. What role does the funding play with the in the adoption of innovation, Godfrey? Your company on the dental technology side is really at the forefront of the adoption of innovation, in particular when I think about a digital workflow, and there are many other parts. Does the funding, from your experience when you look into different countries where your company is operating, does it have an impact on how quickly or how slowly new technology is adopted?
Funny enough, I don't see a big impact from government fundings. The only example that I could see, perhaps, it's Holland. I think because of the government funding or encouragement, they are the country that adopt new technology faster than anybody else. But elsewhere, I don't see much happening.
Okay. How about Scandinavia when it comes to implant care, implant-supported dentures?
Of course, if you talk about implant, Sweden is the pioneer. And of course, it's all because of the encouragement and help from the government that makes it the country where implant is the most popular restoration that you could find. I think almost every patient, they do implants.
So it's then the leadership of, in that respect, the health ministry driving technology and providing access to patients to particular new developments in dental care.
Yeah, of course. When you talk about leadership, it makes me almost laugh, because why? When I think about France, because of the healthcare system, because of the way they subsidize dental treatment, when you look at crown and bridges, every crown that you see root treated, you will see a lot of pose and core. Every tooth that you see that needs crown are endodontically treated, and you have a post and core with it. So it's a funny phenomenon. When you look at it, it never happened to other countries. So if the government do a funny thing, and then funny thing will at the end happen to the community, and you look at dental treatments, and then suddenly you find why, and you start scratching your head. Why every patient needs a pose and core. So
yeah. I mean, I think this is the point you are alluding to. On the one hand, has to do with that reimbursement drives care. And secondly, that Raymond will be understanding is the difficulty of regulators to do something, because the regulator, once it has gone through the process, the regulation drives behavior. And if it drives behavior in the wrong direction, then it's very difficult to correct it and to change it. Raymond?
Yeah, regulation.
That's why.
It's always difficult, right? Because you have to impose boundary to people behavior, right? For example, Mr. I's pinpoint. Actually, the answer is obvious. Why there's so many pros and cons? Maybe it's relating to the reimbursement schedule of the dental treatment. That is something that we do not want to see. Want it happen as a regulator. Okay, I think we put the patient best interest in the very first place. Okay, what should we do? Well, we should do what should we do? Right, should be done. I should. And yes, regulation. But I think it's more on the in terms of that financing issue is all on the government side. Okay, the regulator in Hong Kong, we just regulate dentists. All right, in terms of controlling the proper utilization of the resources, it still rests on the auditing procedure, the quality assurance procedure, the governance of the organization that carry out that program, and that rests on the shoulder of the government.
Yeah. So when it comes to representing the interest of the patient in terms of safety and efficacy, the advances that we see in healthcare in general, as well as in oral healthcare, must put pressure on you as a regulator. On the one hand, to see what is the safety of these new procedures, these new approaches towards care. So to be potentially on the conservative side, at the same token, allowing access to that type of care to patients. How do you balance this dichotomy?
Access of care, you mean? And to actually, may I have your question again?
Sorry. As a regulator, you make sure that patients remain safe and that there are no unsafe, unproven procedures that are being performed. At the same token, medical advances result in new technologies that are potentially better. They may be less expensive. They may be more efficacious. And so at what point does the regulation follow the advancement in science? And of course, there needs to be evidence to support that.
I get your question. Okay.
Yeah.
Actually, technology is developing in the speed of light. And we're all facing a very different thing as compared with what we have learned in our undergraduate. Okay, for example, surely Mr. I can tell me more, but the main trend is on the information IT assisted procedure. And there's a recent trend of tele-dentistry. These are all the challenges to regulator to the profession. Okay, because it really affect what is the well, we can say there's a paradigm shift actually from the perspective of the public expectation on dental care. There is a direct to customer service on certain brand of dental treatment as well. Okay, so we were to tackle these changes. The basic principle or the thing that we have to look into is patient safety, and the second thing is patient safety, and the last one is patient safety. Right. So we have to put that in the very first place, and at the same time we have to balance the customer interests as well. For their free will to access to whatever they want. We have to strike the balance. We have to, in terms of regulation, we have to we define the definition of the practicing dentistry. Well, we have to look into how we regulate tele-dentistry as well, because in some cases there is no direct contact. There's no proper all diagnosis and treatment planning, and everything is deviated from what the paradigms that we have been working for decades. Right. So we are looking at that, and that actually there's the global trend for regulator to look in this matter as well.
Right. I mean that all has implication not only on safety but also on liability issues. If there are adverse events that always happen in a surgical field, and there the regulation plays an important role. How is the standard of care defined? In North America, there are basically two ways of doing it. Some states look at the standard of care is what most of the dentists in the community are practicing. And in other states, and actually the majority of the states in North America,
well, back to something more conceptual. In Hong Kong, we, in terms of regulation, we still operate under a self-regulating mode. Okay, what does it mean? And because dentist is a profession of exclusive expertise, and we have to gone through the training, or because we have done our best, we have imposed all the system of quality assurance that it earned the public trust. And in return, the patient grant us the autonomy to make the best clinical decision for them. This is how we operate at the moment. So in terms of standard, well, we have to take into consideration of how the other part of the world is doing and what should become mutually agreed within the profession, right? So stick is the direction we set up our standard. And the way that we operate, the self-regulation is under the statutory, where we're in a statutory position. We will operate under the Chapter 156 Dentist Registration Ordinance. Under all circumstances, we operate according to the law, right? So in formulating the standard, we'll adopt what I have mentioned is about the common consensus internationally and locally. And of course, in close consultation with all the stakeholders, especially the academia.
Yeah. Godfrey, when it comes to digital technologies, the advances are amazing, and they also seem to disrupt some of the traditional business models. One thing I want to point out is that we have some companies also now in Hong Kong who are offering some type of care direct to the consumer. So they are going around the professional. They do need somebody who manufactures the devices, in particular, as an example, clear aligners. And from the industry perspective, what is the potential there, and what may be the challenges?
I mean, from the business point of view, of course, if the appliance can be open to public, that means if you could sell directly to the public, the demand would be big and maybe you could make good money. But on the other hand, from the professional ethics side, personally, I don't think it's the right thing to do, because you may be doing something that sacrifices the patient's safety, just like Raymond suggested. Unless you are doing it, in a very disciplined manner, screen the case really carefully and do only minor adjustment that is, safe. Otherwise, it's not good to the public. That's what I feel.
I think safety certainly is the highest priority. But when we look at new technologies such as AI, will AI be able to identify which cases are safe, which are not safe? Charles, you're the expert in that.
Yeah, well, thank you for the question. And now we were talking about clear aligners, and there are lots of technology developing in orthodontics, and one of which is using computer software to align teeth on computer. And with the aligned teeth on computer, you make the clear aligner accordingly, and you give it to the patient so that they move the teeth accordingly. Well, it's a very idealistic thing to think like that. I mean, I've been trying out those programs, and obviously it's not there yet. So at this moment, I would say definitely you cannot rely on AI to do all the alignments. And I'm just talking about alignments. How to get to that alignment is another issue. And whether that alignment is correct is a further issue. So actually, it took us 12 years to become an orthodontist, and there are a lot of things that beyond the alignment itself. So even just focusing on the alignment, there has been a lot of issue. So I think it is a good way, to advance the technology, trying to reduce the workload of the orthodontist or the dentist to work clinically by doing this kind of technology, using a computer to do some of the work. But then I think it still takes quite a lot of time before we get there. And therefore, I totally agree with Godfrey that it is most important to safeguard the public safety. And if you just focus on alignment, actually you have ignored a lot of other things, because what we are changing with the aligners is not just the teeth, but also your face. You may not have a very nice face after the alignment. And also because these sorts of company, they cannot take X-ray because they are not licensed like us, the dentists. And therefore, sometimes they move the teeth, beyond the boundaries that the body can take. So it's not a very biological movement. And eventually you get, complications on the gums, on the teeth, and you may end up having even more problems that you have to seek several specialty to handle the problems. So we have already seen some of the cases in other parts of the world, but it's just starting in Hong Kong. So I think we really need to take keep an eye on it.
Right. With all new developments, there comes opportunities and risks. When it comes to one risk and maybe also opportunity we have in the current situation with the COVID pandemic, Godfrey, you have over 5,000 employees operating in more than 20 countries. How do you deal with that crisis?
It was tough. Actually, as far as we are concerned, we thought, again, safety always comes first. We have to make sure that all the staff will follow our protocols on wearing masks, face masks, washing their hands, keeping distance, and then we check their body temperature every day, every time when they leave the office, and so on and so forth. So just to make sure that safety is there. We are very lucky. Until today, I think around the group, among our 5,000 employees, only one got infected, and that's an employee in Phoenix, in United States. I think he is recovering now, very lucky. And of course, keeping the safety. And then as far as the company is concerned, when at the start of the COVID-19, we look at our cash situation, and then we thought it would be safe if we have enough cash in bank. Just no matter what happened, we won't collapse. So we look at safety, from a different direction. That's the financial side, and then we did them both. And then, of course, the next thing that we do is to how we can keep the staff morale. So we make sure that they know that the company is strong. And then we also let them know that this is only temporary. As soon as the pandemic is over, we will be able to restart quickly. And of course, during the time, we do a lot of, when business is slowing down, we do a lot of training, internal training, e-training. And then, of course, we also run a lot of courses for the dentists, through the e-learning, we keep our communication, keeping our relationship, and then we prepare for new products, new marketing materials, just get ready for the pandemic to get over. Our thought is, we are lucky that for our industry, the business will not just disappear. For patients who need to have dental treatment because of the pandemic, they don't come at this time, but later on, they will come back again. So unlike, for example, restaurants, that's a disaster. But for us, the demand will still be there. We will pick up again. If I look at our companies today, let's say in July, I think we are getting back more than 95% of our business already. We are more than 90% back to normal. And in some markets, in fact, we recorded 30% more than normal. And then, of course, there are cities where we are still suffering, like in New York, we are still 50% below normal. But then I think the general trend is good. Up to now, I think on average, we are getting maybe 97, 98% normal already. So that's what we've been experiencing.
That's wonderful to hear that the industry is robust, despite the fact that dental care is one of the most risk-prone ones among even other healthcare providers. Yeah. We are running out of time. Thank you all. Thank you, Raymond. Thank you, Godfrey. Thank you, Century and Charles, for your insight, for a stimulating discussion. And I wish you all to stay healthy and safe, and that we together continue to work on the leadership in oral health. With that, I thank you, and I thank also all the guests that have dialed in and will be watching on Facebook as well as Twitter. Thank you so much. Bye-bye.
And bye-bye.
Thank you. Goodbye.
Bye.